Hello, my name is Hannah Tosi and I am a certified EMDR therapist, and I wanted to share with you today what EMDR is. It's an acronym that stands for Eye Movement Desensitization Reprocessing. So I know that's a mouthful and I want to break it down for you. What is this eye movement desensitization and reprocessing all about? So first I'll say that EMDR overall is a super safe and amazingly effective, one of the most effective out there right now, trauma treatment method. It's a way of working through difficult life experiences that you may have had, and other challenges that you may have gone through, and healing from them and integrating these experiences so that you can move past them. So this could be anything from a car accident or another kind of physical accident to complex childhood trauma, sexual violence, chronic illnesses, bullying, intimate partner violence, social oppression. EMDR can be used on a myriad of different issues and help you to change your relationship to those things that you might have lived through. So let's go through each of the letters in the acronym and explain what they mean. So EM, the eye movements. The eye movements are a form of bilateral stimulation. So bilateral means both sides, side to side stimulation. So you have this input coming in, which often is in the form of eye movements. So that might be your therapist asking you to follow with your eyes their fingers as they move them back and forth. They might also use a wand like this and ask you to follow it back and forth with your eyes. And so your eyes are moving right to left, right to left. And you can also use things other than eye movements to do the bilateral stimulation, and research shows that they're just as effective. Some of the other options are tactile stimulation that's self-administered, where you tap back and forth on your arms or your legs. Your therapist, if you would like, might tap back and forth on your knees, sitting across from you. Or another option could be using these tappers, where the therapist holds one end and you hold these buzzers that buzz back and forth, right to left, which could be a nice way of kind of more passively receiving. You could close your eyes and have more imagery come in. And there's also the option of using headphones that make a beeping noise back and forth. And the purpose of the bilateral stimulation is multifaceted. One of the things that it does is keep you grounded in the present moment, right? So if you are focusing on the buzzing back and forth, or your eyes are having to focus on this thing moving back and forth, then you're having to remain engaged in something that's occurring in the present moment. So you have one foot in the here and now, where hopefully you're in a safe space with a therapist that you trust and feel comfortable with, while you're also putting a foot into the past experience and revisiting the trauma. So this helps you from getting overwhelmed by the traumatic material, kind of re-experiencing the trauma, or getting flooded by the emotions or the imagery, because you're titrating. You're kind of going into the past, but you're also in the present at the same time. Another thing that the bilateral stimulation does is that it activates the different hemispheres of your brain. So each time you have a stimulus on the right side or the left side, the alternate hemispheres of your brain light up with activity. And this helps your brain make more connections and helps you learn from the traumatic experience more. So this could be learning, for example, okay, it's over now. It's also linking the kind of emotional centers of your brain with the more rational, logic, meaning-making centers of your brain, and kind of getting more parts of you online, so that you're not just talking about the issue, you're actually feeling your way through it, bringing in all the different aspects of yourself, from your defenses that have been kind of helping you survive since you experienced the trauma, to the wounded parts, and also your kind of resourced and strength-based parts can all be online in the process. It also incorporates your body in the healing. So inherently doing these eye movements or feeling that buzzing sensation or sensing the gentle massage back and forth keeps you kind of anchored in and grounded in your body, so that you're not just kind of exploring it from the neck up, kind of in your heady space, just talking like we can sometimes in supportive talk therapy. You're really bringing in your body, your emotions, your nervous system. The bilateral stimulation is very soothing for the nervous system. So you can think about it, this isn't soothing for everybody, but think about like, a baby being rocked from side to side. That's kind of a gentle, relaxing kind of lullaby type of energy, or a group of people dancing and kind of bopping back and forth, right and left. That could be kind of something that is a good kind of outlet for your nervous system to get that fight or flight energy out, or keep you from getting into the freeze response. Or you could also think about the energy of going on a walk in nature. The right, left. There's something rhythmic about that, soothing. I think, some of you might relate to that idea of like when you're walking, or if you're a runner, you like to swim, there's something very comforting about that. And it kind of brings your whole body online and crossing this like midline of your body at your core. And that helps kind of awaken your whole being. So that's some of what there is to know about the bilateral stimulation, the EM component of the EMDR. If you're curious, feel free to reach out and I can always share more with you about it. But then we also have the D. So the D of EMDR is desensitization. So I'm sure that many of you are aware that living through trauma also, not only do you have to go through that hard experience, which can be very emotional in the moment, but there also may be challenging emotions that linger and carry on and almost become like a burden that you're carrying around. It could be grief about what you went through, or aspects of your life that were lost. It could be anger about the unfairness. Maybe there's fear, the feeling of being scared of it happening again, or shame. We might blame ourselves or feel like it happened because we were unworthy in some way. And these feelings can stay stuck inside us for a long time and kind of leak out. It's like a sore spot that gets hit by things in our lives. So trigger responses like being around a somewhat similar situation might bring it all back, or maybe there's flashbacks where all those emotions are suddenly coming out to the surface. Sometimes they come out in nightmares. When you let your guard down, it all bubbles up. Other times it might come up in kind of more less obvious ways of being connected to the issue, but the trauma, but like low self-esteem, for example, could be connected to like the shame that's associated with having gone through that stuff in the past. So these are just some of the ways that the trauma emotions can really be very sensitive. And so the D is the desensitizing of this. And we do the desensitizing through processing the memory holistically. So if we're working together, we'll activate the memory about how we call up an image associated with the memory or the experience, emotions, beliefs that it taught you to have about yourself, and body sensations. And then we'll process that in manageable small chunks, bit by bit, so that it doesn't feel too overwhelming. And I'm here with you throughout all of that, creating space, making sure that it's feeling like it's manageable. And I think that the catchy, kind of cheesy therapist rhyming line that best speaks to the desensitization process is, we got to feel it to heal it. So you have to feel those emotions and kind of acknowledge them and validate them in order for them to be able to move along. And sometimes that happens spontaneously and the memory does not get stored as a traumatic memory, but sometimes it feels too overwhelming to do that process on your own. And sometimes there just might not be the right conditions, like, you know, that 1 foot in the present and the 1 foot in the past that I was talking about before, or having a supportive person around to help you sort through it. And so with EMDR, we're creating the optimum conditions for you to feel it, to heal it. So we are creating that safe space where your brain can really learn that it's in the past now. And when those conditions are there, you have a chance for your nervous system to really express what it was like to be in there, to kind of move the fight, flight, freeze, fawn responses out and through. And it's amazing to see that memories, really upsetting memories that I worked through with folks that, like on a 0 to 10 scale of how bad it makes them feel before we work on it, maybe they rate it a 9 or a 10. It's like they can barely look at it. By the time we've worked through the memory, they can really say that it's a 1 or a 0, that they can look at it and feel neutral, or they can even look at it and feel something positive, like, wow, I was really strong to get through that. And I know that this might sound kind of like pseudoscience, or kind of like, you know, selling you some snake oil, or like it's miraculous, and it can sometimes feel that way because it is such a transformation, but it's really rooted in neuroscience, and this is a really real phenomena that happens, and I've seen it over and over again for some of the most difficult things that a human can go through, that they really can heal from this. And your brain knows what it needs to heal. It just needs those right conditions to get to that information. And sometimes that material is just ready to come on out right when we access the memory. You know, it wasn't my fault, it was actually them. The anger shouldn't be directed at me, it should be directed at this injustice. Things like that will start to come out. Or, you know, those tears that have been at bay will finally get a chance to move out. It might feel lighter, unburdened. And other times, you know, especially with complex trauma where there was multiple issues way back from childhood, there might be a little bit more intervention from me, your therapist, where I might be like, hey, you know, like, look at how old you were when you went through that. How you know, would you expect a 6-year-old to have known better? Just little tidbits like that I'll kind of pepper in here and there can help kind of reinforce the strength-based kind of information. So for the most part, it's a self-directed, self-guided process, and it's beautiful to witness the different imagery, the different strengths that a client might connect with about themselves, and that's something that I couldn't have done for them, and I love that it's such an empowering process that really centers clients' agency. And then lastly, we have the R. The R is for reprocessing. So I was kind of already talking about that a little bit with how trauma teaches us things about ourselves or the world that, you know, on one hand we know they're not true after the fact, but on the other hand we can't help but feel that way anyways. So maybe trauma taught you I'm not safe, or maybe it taught you something like I'm powerless, I'm helpless, or maybe something like no one loves me, I'm unlovable, I'm not worthy. And the EMDR, when your brain is working through those difficult emotions, once the emotions move along, inevitably your brain will start to connect with kind of corrective information, or what in EMDR we call adaptive information. And as your therapist, I can help you access that information a bit more easily through helping you develop your strengths and resources. But as you begin to connect with this strength-based information, your your memories are beginning to integrate, and the trauma is becoming part of your whole life kind of narrative, rather than kind of staying on the top and standing out, kind of disconnected neural networking from the rest of your memories. So as more connections are made, your brain will start to recognize things like, wow, it really is over now. It's not happening anymore. Maybe I had that one horrific car accident, but I've been in a car thousands of other times where I didn't have accidents, and I am relatively safe, but maybe I'll be a little bit more cautious without being full-blown hypervigilant. Or maybe your brain will learn different things like, okay, I didn't have power in that situation where I was just a little kid and my parents were making all these misinformed decisions that had a negative impact on me. But now I'm an adult and I'm in control of my own life, and I do have agency and choices. Or maybe my partner didn't know how to love me the way that I needed due to his shortcomings, but my friends really care, and that really wasn't a reflection of me. I am a good person. I am lovable. And these are the types of things that, in like cognitive behavioral therapy, you might also connect with this kind of reframing how you're looking at situations. But what's different about it in EMDR is it really comes from within, and it's linking to a really felt sense in your body. So you're not just telling yourself those things, you're really feeling those things. And they can feel so much more true when it comes from that place. One thing that is amazing to witness as an EMDR therapist is watching someone working through their traumatic memories. And that can look like different methods. For some folks, we might be really thorough and work chronologically, starting at the earliest challenging thing you've ever experienced all the way up until the most recent one, working that chronological focus. And others might have a specific issue that they want to focus in on, say a particular type of abuse that they experienced, or a symptom that's really bothering them that we might hone in on and choose memories that are kind of feeding into it, which I would help them determine what those memories were. But what I've seen, no matter what approach we use, is the deeper they get into the process, the more experiences that they work through and integrate, that their confidence grows, their self-esteem kind of really blossoms. They feel much more empowered, much more agency, and a lot more self-worth and belief in themselves, and a sense of belonging and connection, both within and to the world around them. And I'm so honored to support people in that process, and that people trust me with these sensitive issues, and that I can support them, the EMDR can support them and guide them into a place of more wholeness beyond their limited kind of trauma-based sense of who they are and how they fit into the world. So it's a really powerful modality. I would love to share more with you about it. If you're curious, please feel free to reach out, and I would love to hear more about your individual circumstance, and we can talk a bit about EMDR and if it would be a good fit for you at this time. So thanks so much, and take care.